A group known as the Civil Society for HIV and AIDS in Nigeria has urged President Muhammadu Buhari to fully mobilize local resources through public-private partnerships so as to ensure there is a fully functional health system for primary to secondary and tertiary levels devoid of corruption, with focus on manufacturing antiretroviral drugs locally to minimize the huge amount of resources spent on international procurement of the drugs. Speaking at a press conference in Abuja, chairman of the group, Remi Obinatu, said the Nigerian government and its allied agencies seem to be doing nothing following the withdrawal of support by international donors, leading to introduction of huge user fees ranging from purchase of hospital cards to baseline and routine chemistry test charges, with abysmal reduction in quality of services provided by people actually living with HIV/AIDS. Also speaking at the event, Victor Olaore from the network of people living with HIV and AIDS in Nigeria decried the fact that different facilities across the country have shifted the burden of donor fatigue and lack of government support to patients by introducing unnecessary charges.
The treatment facilities have, in response to this withdrawal of support, introduced huge user fees ranging from purchase of hospital cards to baseline and routine chemistry tests, with abysmal reduction in the quality of services provided to PLHIVs in the facilities. It will also be very important to state that from studies, 80% of people living with HIV/AIDS are poor and cannot afford to provide nutritional support to either themselves or their households, not to talk about being able to pay for these user fees that are charged at the treatment facilities. Many young persons who are unemployed and living with the virus are also affected by the recent development. Many positive women who have either lost their husbands to the disease or been driven away from their matrimonial homes, and even many that are still married, cannot afford the user fees. We have also not forgotten the many Nigerian children who are also HIV positive, who are also affected by these user fees. The resultant effect of all these is that many of the PLHs in the country have started to default from adherence to their drugs by missing their routine appointments in the treatment facilities. This will definitely reverse the achievements of the national response in no distant time. There's an opportunity that the national response may receive attention of the anti-corruption and people-oriented agenda of Mr. President to fully mobilize local resources through public-private partnership. Nigeria must move in the direction of also ensuring a fully functional health system from primary to secondary and tertiary, devoid of corruption and of manufacturing antiretroviral drugs locally to minimize the large amounts of resources spent on international procurement of the drugs.
In most of the facilities now, before you do your drug pickup, you have to pay the likes for like 1,000 naira for drugs, and all of these have been budgeted for. The drugs have been paid for by the international community. So we don't know why they are charging the poor Nigerians living with HIV and AIDS this kind of fee. Some people are just there to defraud the patient community, and we believe that the President, Muhammadu Buhari, will be watching this, but he will not keep quiet. They want us to use this opportunity. We want Nigerian government to intervene. Each month you come to do your drug pickup, you pay about 1,000 naira. When you come to do consultation, you pay a minimum of 3,000 naira. You pay 1,000 naira each month for bleeding. This is uncalled for. These doctors have their salary budgeted for by the government, and these drugs are being budgeted for by the international communities. Why should the patient be the ones that will be paying for consultation to see a doctor if we are going to, as if we are going to a private hospital? We are using this medium to appeal to the government through the Minister of Health, Professor Isaac Adewale, to use his good office to ensure that there is an end to this satanic development in the health response. Nigeria cannot end AIDS by 2030 if poor Nigerians infected with HIV do not have access to free treatment, care and support services in the country.